Good evening. My name is Mia Wallace, and I'm going to be explaining to you epilepsy. Imagine being abruptly unable to move or talk due to loss of control over your body. For more than 50 million people worldwide who have epilepsy, this is their story. Many causes of seizures have been coming across major news stations. I'm a mother, caretaker, and sister of two who suffers from epilepsy. Many causes of seizures have been coming across major news stations. Today, I'm going to inform you about what epilepsy is, causes, symptoms, and how it can be managed. First, I'm going to tell you about what epilepsy is. Second, I will tell you about the cause and symptoms of epilepsy. Third, I will explain the method for successfully managing epilepsy. First, I'm going to tell you about what epilepsy is. What is epilepsy? Epilepsy is a persistent neurological condition marked by frequent spontaneous seizures, which are sudden bursts of electrical activity in the brain. Epilepsy is a brain disorder that causes recurring, unprovoked seizures. If you have epilepsy, surges of electrical activity in your brain can cause recurring seizures. Epilepsy.com. Seizure types: focal seizures, which impact a particular area of the brain, can cause symptoms such as twitching or strange sensations. Generalized seizures affecting the entire brain, loss of consciousness, and or convulsions. Now that I've told you about epilepsy, now I'm going to tell you about the causes and symptoms of epilepsy. Risk factors and causes. Epilepsy can occasionally run in families, pointing as possible hereditary, causing there are certain gene alterations that can make a person more prone to seizures. Brain injury. Severe head trauma, like that from a car accident, can cause epilepsy. Sometimes years after the original trauma, according to the National Institute of Neurological and Strokes. Infections. Epilepsy can be brought on by infections that affect the brain, such as encephalitis, meningitis, developmental abnormalities, or traumatic brain injury. Developmental displays. There is a higher chance of epilepsy in children with developmental disorders or neurodevelopmental delays. Signs and causes of illness. Common symptoms. Seizures are the hallmark of epilepsy, and they can manifest in many ways, from full body convulsions to staring spells and confusion. Diagnosis. The process of diagnosing epilepsy is the use of instruments such as MRI and EEGs. Is a tool that doctors use to monitor brain waves for aberrant activity in order to find instructional abnormalities in the brain. Now that I've told you about the causes and symptoms of epilepsy, now I'm going to tell you about the methods for successful managing epilepsy. Oversight and intervention. Anti-seizure drugs are useful in reducing seizures for a large number of people. However, it can take some time to determine the appropriate prescription and drug dosage, and some people may have adverse effects. Treatment options for surgery. Surgically exercising the area of the brain responsible for the seizures may be an option for those who do not respond to medicine. Lifestyle modifications. The key to managing epilepsy is to maintain regular sleep schedule, manage and avoid known seizure triggers. Support system is important. Get help from family, friends, and epilepsy support groups. People with epilepsy can lead fulfilling lives with the right support system, but living with epilepsy can be challenging. We now know more about epilepsy, including its causes and management options. With the correct care, many people with epilepsy can lead active lives despite having any serious conditions. The first step in helping those who have epilepsy is understanding it. By working together, we can lessen the stigma and support individuals who are impacted by this illness. Thank you for your attention.